Today we're going to have Dr. Toyin Olutoye, Vice Chair of the Academic Affairs and Division Chief of General Anesthesia from Texas Children's Hospital. It's a great pleasure to have you here today. For those of us who may not know you so well, would you mind giving us a brief summary about yourself?
Sure, Allison. Thank you for speaking with me today. My name, as you mentioned, is Toyin Olutoye. I'm a pediatric anesthesiologist, and I work at Texas Children's Hospital. I've worked there for the past 20 years. I'm also a wife. I'm a mother of 2 adult children, and I recently became a grandmother. I have a 2-month-old grandson, and I love what I do, working as a pediatric anesthesiologist. And I have a passion for bringing up younger women, junior women who would want to walk in the same path that I have gone. And I'm also a stickler for equality and people being treated right.
Well, thank you. It's great having you here, and congratulations.
Thank you so much. Yes, it is.
You have a unique perspective in that you completed medical school in Nigeria and you did your anesthesia training here in the United States. What career path were you contemplating when you finished residency?
I knew I wanted to be acutely involved in patient care, and I didn't really enjoy the chronicity of seeing the same patient over and over. And that was what kind of steered me into anesthesiology. And then once I was in anesthesiology, I found the intricacies of pediatric anesthesia very, very attractive. You always had to pay attention to every little detail, and you could never say you were doing a bread and butter case because you never knew if you would have a problem with the airway or if the IV was going to be challenging, or if you're going to have a huge amount of blood loss, which in a small child is very significant. So I like that challenge. To me, it was much better than being in a vascular case for all day vascular case. And that's how I ended up in pediatric anesthesia.
Yeah, me too. That's why I love peds.
Yeah. Mm-hmm.
It's fun. It's great. Yeah. It's fun all around. Any suggestions for young researchers trying to identify fields on how to select or be selective?
Mm-hmm. I think it depends primarily on interest, on if you are interested in either clinical research or basic science research. There are not many basic science researchers in our field, and that would be related to exposure, I would say. It depends on if you can find adequate mentors to put you through that process. A lot more people in anesthesia are clinical researchers, and I think as a clinical researcher, you have to have an inquisitive mind, a curious mind. And in the course of our day-to-day work, we always come across questions. Why do we do this way? Or why do these patients always wake up in a certain way? Why do we always give this medication and not that medication? Mm-hmm. And I think those kind of questions in our minds give rise to clinical research, because when you have a question in your day-to-day work, the next step would be to do a literature review to find out why you're doing this. And if there is no answer that you can find, then you're the person to do the study and find out the results, find out the answer to the question you're asking. And I think the same holds true for even translational research or basic science research. If you have a question and you have the means to pursue research in that area, then you should go for it.
It's great to have mentors to help you facilitate that. I think when you're first starting out, sometimes you can be like overwhelmed or a little spooked by research because it seems like such a big field or big job, I guess. But if you take it baby steps, you get there slowly but surely.
Yes, definitely. I mean, it's not something you jump into as a young faculty starting your new job. Mm-hmm. You definitely want to get the hang of clinical care, mm-hmm. find out what you're good at, what you want to improve at, or improve in, and then you can start asking the questions and seeking the answers.
Academic time, grants, and resources are scarce. How do you manage to accomplish this?
I would say that the setup is different in each institution, but in general, one usually has to put in a whole lot of work before you are able to seek non-clinical time to be able to pursue your other activities. And this work that you would have to do would have to be on your own time. And that usually is a challenge for many people, to work on your own time. When I first started working, I was working part-time because my children were little. And as they started to grow older, I didn't necessarily need the part-time, the day that I had, or I didn't have to spend the whole day with them. So I would cut the day short, maybe come into the office for a couple of hours. Now, granted, that was on my day off. It was on my time. But I'll come to the office, put in a couple of hours and then go back and run my errands. So I was working on my part-time day off, but at least it was convenient for me, and I was able to do that. And I was able to still work with my children, carry them wherever I wanted to go, and put whatever time I wanted to into my work. So I think, at least for me, that's how it worked. And it probably would work the same for other people. I think if you put in a little bit extra on your own personal time and you prove what you can do, then you'll be able to get more time. So you need to have people believe in what you can produce with limited amount of time, and then you get more.
That's a common road that I have heard from other women and men who have become accomplished, whether it's in research or advocacy or some other venue outside of the operating room. So
yeah, it's not uncommon to have to put in an hour or two on the weekends. But one has to be able to manage it. So so you're not working entirely on the weekend and ignoring your family. You have to be able to balance it somehow.
Yes. Oh, yes. And we'll get to those questions. What drove you to seek these leadership opportunities, and how did you find them, or how did they find you?
I get asked that all the time. What made you seek leadership opportunities? And the truth of the matter is I didn't seek them. They found me. And, in all the leadership positions that I'm in, I was asked to assume those roles. And it was something that I thought about deeply each time to see if it was something that I wanted to take on. Because, leadership, there's a title, and then the second thing and the main thing is the job that you have to do, all encompassed underneath that title. So it's not an easy task to assume a leadership position. And I'm grateful I was approached to assume these roles, but I didn't necessarily seek them for myself.
When you're deciding on a role to take on, what makes you decide whether to take it or not? Are there any criteria that you have, or things that people should consider when they're asked to take a role?
When asked to take on a role, what the things I think about, one of them includes time, of course, because there is a big time commitment that you would be working, after hours, trying to get things done and meeting deadlines. And you now have a lot more meetings to attend. So if you have personal work, research work, or, educational work, whatever it may be, they would suffer somewhat because you now have all these administrative responsibilities. So one, I have to think of the time commitment, and you have to think about your personal life, if it's something that you can fit in, or is it going to hamper your personal life in any way, shape, or form. Another thing I think about, is it going to, for me, is it going to make me compromise my integrity? Am I going to be able to be truthful and function in the way that I believe I should function? I wouldn't want to take on a role that would make me compromise integrity in any way, shape, or form. And can I do the job? What is the job description? And do I think I can do it? Those are the things that go through my mind when I'm asked to take on a leadership role.
Thanks. That's really helpful. I think that's some great advice, and kind of like a checklist to run through, like, okay, can I do this? Is this realistic for me? That's great. If you were talking to your younger self, what advice would you give to your younger self?
I was talking to my younger self, I would say totally ignore the critics and stay focused. Even though I have managed to stay focused, I will admit there were times when when I look around, or you're going down this path, and sometimes it's hard to just stay focused and go straight down the path and not look to the right or look to the left.
Mm-hmm.
Not look to the right to people making comments about whatever it is, non-clinical time, or, what is the reason for this research question, and who cares about this research question, or.
That's great advice.
Mm-hmm.
Yeah. Yeah, that's always, what is it called? The water cooler talk.
Mm-hmm. Mm-hmm. Yeah. I mean, you have to assume you would be the topic at some point, and you just have to have thick skin and not care and move on and just stay focused on what you want to do. All right.
But thanks again. I appreciate your time and all your advice. It's wonderful.
Thank you. You're so sweet.